Did you know that nearly 50% of young cancer survivors struggle with infertility after treatment? The effects of cancer can go beyond survival, impacting life in unexpected ways. Welcome back to Channel Name. Today, we're tackling a topic that isn't often discussed: the surprising connection between cancer and infertility. For many, a cancer diagnosis is a life-changing experience. But what often goes unmentioned is how treatments meant to save lives can also impact fertility. This link has real-life implications, especially for younger patients who may not yet have had the chance to start families. Let's explore why this issue is so important and what cancer survivors need to know about preserving fertility. Surviving cancer is an incredible feat, but for many, the journey doesn't end with remission. The treatments that fight cancer, like chemotherapy, radiation, and certain surgeries, can have lasting effects on fertility. For young survivors, this can be devastating, as they may face challenges in starting or growing a family. In particular, chemotherapy targets rapidly dividing cells, which, while effective against cancer, also affects reproductive cells. Radiation therapy, depending on the area treated, can similarly impact the reproductive organs. This risk of infertility is a harsh reality for many, and it brings with it a complex set of emotions: fear, sadness, and sometimes guilt. Survivors often find themselves feeling isolated in this struggle, as fertility is a deeply personal issue, and it isn't always easy to talk about. Let's dive deeper into how specific cancer treatments affect fertility and why this link exists. 1. Chemotherapy. Chemotherapy works by targeting fast-growing cells, a defining trait of cancer cells. However, this mechanism also impacts other rapidly dividing cells, including those in the ovaries and testes. Drugs commonly used in chemotherapy can lead to reduced egg or sperm count, which may result in temporary or permanent infertility. For women, this may also lead to premature ovarian failure, effectively causing early menopause. 2. Radiation therapy. Radiation therapy is another treatment that, while effective, can damage reproductive organs depending on the area being treated. Radiation to the pelvic area, for example, can harm the ovaries, uterus, or testes, leading to infertility. For men, radiation near the pelvis can reduce sperm production, and for women, radiation targeting the abdominal area can damage the eggs or even make the uterus unsuitable for pregnancy. 3. Surgical treatments. Some cancer treatments involve surgeries, such as removing reproductive organs, which obviously impacts fertility. This is often the case for cancers in the reproductive system, like ovarian or testicular cancer. Even surgeries that don't remove reproductive organs can cause scarring or other damage that affects fertility. 4. Emotional stories and real-life testimonies. Imagine being in your early 20s, beating cancer, and then finding out you may never be able to have children. Many survivors share that this news can feel like a secondary loss, and while it may be overshadowed by the victory over cancer, it's a very real pain. Support groups and counseling have become essential resources, providing a space for survivors to process these feelings and explore their options. Here's a startling fact. According to recent research, up to 80% of young women with breast cancer will experience some degree of infertility as a result of their treatment. This statistic underscores the importance of discussing fertility preservation before treatment begins. Fortunately, medical advancements have made options like egg or sperm freezing more accessible, giving survivors a chance at parenthood later on. But awareness is key. Many patients aren't informed about these options until it's too late, which makes it crucial for healthcare providers to address fertility preservation early in the treatment process. To wrap up, the connection between infertility and cancer is a deeply impactful issue. Treatments like chemotherapy, radiation and surgery can save lives, but they may also limit the ability to start a family. Understanding these risks and exploring preservation options can empower survivors and give them hope for the future. Whether through medical intervention or support networks, addressing infertility alongside cancer treatment can make a huge difference in survivors' quality of life. If you or someone you know has experienced this, we'd love to hear your story. Feel free to share in the comments. And for more content on health and wellness, check out our related videos and don't forget to subscribe. Thanks for watching.